Hi, I'm Abby, and I'm an advanced clinical practitioner in the emergency department at Wrexham Mylor Hospital in North Wales. I have recently finished my master's degree in advanced clinical practice and completed a dissertation project, The Impact of ACPs in Emergency Care, a systematic scoping review. As it was an individual project, a formal systematic review was not possible, but it was done in a systematic manner, and I'm going to go through this dissertation project with you as a poster today. So why did I choose this subject and what was my aim? As we are all too aware, EDs globally are facing unprecedented demand for services and workflow strains, and ACPs were introduced partly to help with these challenges. And evidence so far shows that we are making a positive impact, improving outcomes and overall care. However, the majority of this evidence comes from primary care research. So in 2017, an ACP called Kyle Williams reviewed the evidence surrounding this topic, specifically in emergency care. He found some benefits like improvements in key performance indicators and overall feedback, but he only identified 4 relevant papers and called for more focused research on ACPs in emergency care. Since then, the number of emergency medicine ACPs has tripled, so I wanted to see if the evidence has grown too. My aim, therefore, was to partially replicate Williams's review to map out any new, high-quality evidence that could inform benchmarking practices and future strategic planning. So I chose a scoping review as a method to map the evidence of a broad topic. I looked at studies from 2014 to 2024, which allowed a slight overlap with Williams, but also captured more recent and relevant literature. At first, I limited it to UK-based studies, but like Williams, I found very little available evidence. So I widened the search to include international studies and adjusted the inclusion criteria to capture a broader set of outcomes. Whilst the international studies did bring some variation in how ACP roles were defined and delivered, it ultimately gave a richer overall picture. In total, 20 studies were included, covering quantitative, qualitative, and mixed methods research. Moving on to the findings. The quantitative insights mainly came from retrospective studies, which have their own limitations, but overall highlighted no negative impacts on key performance indicators associated with ACP care, and the following potential benchmarking metrics. Productivity. ACPs were found to be as productive as other equally as qualified emergency medicine clinicians. ACPs were found to use more resources than other emergency medicine clinicians. If these are frequent requests of low-value diagnostics, then this is a potential service improvement or educational opportunity. And ACPs had a lower rate of unplanned returns. The qualitative findings, whilst not objective, provide context and insight into the softer aspects of care, including consistent positive feedback from both colleagues and service users, and were associated with high quality care. Broader factors like staff retention and longevity and reduced reliance on temporary staffing, all of which have clinical and financial benefits. But what was missing? The review did uncover some useful benchmarking metrics, as mentioned, but it did not significantly expand the existing pool of evidence. Critically, it highlighted a real gap in safety and quality metrics, such as mortality rates, diagnostic accuracy, prescribing safety and error rates, and adherence to evidence-based practice. And these are exactly the kind of metrics that organisations such as Welsh Government, the Royal College of Emergency Medicine, and the Academy of Advanced Practice Research are calling for as research priorities. Also, much of the evidence focused on lower acuity presentations. So moving forward, where do we go from here? The value of ACPs in emergency care is clear: improve patient care, team dynamics, and service delivery. But moving forward, it appears there is a lack of quality and safety data, which should be future areas of focus to ensure our care delivery is not just effective, but consistently safe and of high quality. We should consider aiming to produce benchmarkable data that can be used across departments to assess whether ACPs are performing to a recognised standard. These metrics should also reflect the full spectrum of emergency care. Together, we should work to find the most meaningful metrics that are not just clinically relevant, but also practical to collect and compare. Once identified, we could share these nationally or internationally to ensure consistency and drive improvement. Ultimately, we should have mechanisms in place to monitor practice, learn from it, and continuously refine it. It was such a complex topic to unpick, and there's much more detail in my main dissertation. So if you want to have a little bit more insight, you can scan the abstract QR code, or alternatively, head to the list of references within the code at the bottom. And thank you for your time.